Well, this is a 64 years old male presenting with the only history of epigastric discomfort, not even pain. No, I do not have any lab profile available. Nothing is available except the patient and me and the ultrasound. So let's see the status of the gallbladder first of all, being an epigastric issue. Now this is the gallbladder, so there is no pathology relating to the gallbladder. However, now I'm going to scan the liver. In the liver you will see, I will first of all see the outer surface of the liver. Now this is the outer surface of the liver, and it does show my irregular outer surface is seen, and interspread in the right lobe are seen hypoechoic. Now this is a rounded hypoechoic area with no posterior shadowing. This is a focal lesion. Now there are multiple focal lesions of now this is another focal lesion, this one, which is heterogeneous. Now this is the one that is ill-defined, is inhomogeneous, being echogenic as well as hypoechoic. Now another one. Now you see this is another one, which is, yes, this one. Now this one is also ill-defined. Margins are not that clear. But one thing that is obvious is that it has a halo around. Any lesion, any solid lesion having a halo around is very suspicious of being of aggressive nature, as it is. So this is the diaphragm. Now this is in the posterior segment of the right lobe. This is another one with echogenic areas inside, but solid, no posterior shadow. All walls are seen clearly. There is another one with a clear-cut halo around it. This is an echogenic focal lesion, and see the black halo around it, hypoechoic area surrounding it, no posterior shadowing. The echogenic area is well demarcated in this region. So now I'm coming towards the portal vein. This is the portal vein, and you will see a clot within it. This is the portal vein, and this echogenic area filling it is the clot within the portal vein. This is the portal vein, this is the clot within it. Portal vein is dilated, measures approximately, no, it's not dilated, it measures 11.1, and normal is up to 13 millimeter. Now there is another focal lesion, hypoechoic, with the no posterior wall shadowing, ill-defined, and this is a focal lesion, a mass in this region. Now there is a focal lesion seen in the segment 1, which is usually unusual to see. It's very rare. The reason is that this segment, which is called the segment 1 or the caudate lobe of the liver, it has its own blood supply, separate blood supply. Now this is the ligamentum venosum in the left lobe, longitudinal of the left lobe. This is the focal lesion, this area with central echogenic spots within it. So this is the segment 1, bounded anteriorly by the ligamentum venosum and posteriorly by IVC. Now this is the longitudinal section that you are seeing. This is the transverse section of the same segment, ligamentum venosum, segment 1. This is the focal lesion. So, focal lesion in the segment 1 as well. The patient is coughing. Now you see there is a sub-centimeter bullseye appearance. Now this is echogenic in the center, hypoechoic at the periphery, well demarcated, and small sub-centimeter lesion solid. This is a metastatic lesion. These are how they appear as mostly. See this one? There is another one. This is a metastatic lesion. Now see echogenic center, hypoechoic periphery, typical bullseye appearance. What I am doing now is trying to see if I can get you the portal vein again. It's all meshed up, but this is the portal vein. Yeah. This is the portal vein, and it is filled with heterogeneous clot, tumorous clot, we will say that. And in the region of the clot, it measures approximately 23.5 millimeters. So significantly alive in this region, along with, you see, focal lesion, this hypoechoic focal lesion, multiple focal lesion. All segments are studded with focal lesions. None of the segment is spared. Now, this is the pleurophilia. This is fluid in the right pleural space. This is the diaphragm. From different angle, if you wish to see the pleurophilia, see that. This is pleurophilia. This is the pleurophilia, this is the diaphragm. So there is no para-aortic plan and lymph node seen. Now the outer surface of the liver and the texture of the liver is not that bad. That gives me an impression that possibly the primary is in the lung. As the prostate is okay, and there is no pathology seen relating to the bowels on ultrasound, and because of pleurophilia, most probably the primary will be in the. This is the left portal vein and the right portal vein. This is the left portal vein, and this is patent. You see, it's patent. So intrahepatic part of, now this is extrahepatic part of the portal vein, it is patent. Only the intrahepatic part is showing, this one. It shows a clot Now one of the ways to see the clot is, now I have reduced the gain to 0. Even then I can see this is the portal vein. Now this bright area is persistently seen, is still seen, did not vanish with the gain reduced to 0. So this is one of the tricks to see whether you are seeing a solid area or so this is our case of the day. Thank you.